Hello Badgers and welcome back to Badger News, your favorite PUSD news source delivering you the stories that matter from 6 feet away. Yavapai County Community Health Services has reported 65 confirmed cases in the county with its first death. Cases in Yavapai County include 13 in Prescott, 14 in Prescott Valley, 10 in Sedona, 6 in the Verde Valley, 13 in other areas of the Quad Cities, and 1 unknown, according to the latest news release. With more information, we go to Wade.
Wednesday afternoon, April 15th, Yavapai County reports 71 confirmed cases of COVID-19. Statewide, there were an additional 11 deaths reported overnight. While there were 3 Yavapai County cases reported overnight, 2 cases from earlier were determined to be duplicates, resulting in a net gain of 1. According to YCCHS Afternoon Update, 1,754 Yavapai County residents have been tested, with 1,683 results negative, 3 recovered, and 1 death. Of the 71 cases in Yavapai County, 38 are in the Quad City area, including 14 in Prescott Valley and 13 in Prescott.
Now we're here live with the state room to answer some questions. What are some of the symptoms?
The CDC has stated that trouble breathing, persistent pressure on the chest, extensive coughing, and a flushed face are all common symptoms of COVID-19. These symptoms are not all inclusive. You may be asymptomatic and could still be transmitting the virus through sneezing, coughing, and talking through respiratory droplets.
How do you treat a sick person from home?
Well, in order to treat a sick person from home, first create a designated space for the ill person. This includes not sharing the same bathroom if possible, and none of the same dishes or utensils. When removing dishes from the designated space, make sure to immediately disinfect them. Have the ill person cover their mouth and nose when interacting with them. Cleaning bedding and clothing is also an important precaution. Avoid any unnecessary visitors and try to limit the amount of people treating the sick person. Wearing gloves is also a good measure. Treat this person like any other kind of illness, just with more preventative precautions.
Should we all be wearing masks?
It's not as important for everyone to be wearing a medical grade mask as long as there is some sort of covering. It is more important to wash your hands frequently and clean surfaces that are regularly used, like doorknobs, light switches, counter and tabletops, as well as phones, computers, and remotes. Especially for cleaning phones and computers, use a cloth and dampen with 70% rubbing alcohol. For your hands, use a sanitizer that has at least a 60% alcohol content. Staying safe and physically distancing pretty much eliminates the need for regular use of a mask. Hospitals all around are in dire need of PPE, personal protective equipment for healthcare professionals. It is more important for those who are in direct contact to have equipment.
Well, we just want to say a huge thank you to the healthcare providers for their time and their efforts. We understand that you are all under a lot of pressure and working tirelessly to protect our citizens and handle the situation.
Thank you and all of the people helping in any way they can. It's much appreciated.
In other news, Arizona is taking the shelter-in-place seriously. A new law permits officers, deputies, troopers, and others to issue Class 1 misdemeanor citations to people who knowingly fail or refuse to follow such orders. Those found guilty of being a public danger can face up to 6 months behind bars and up to a $2,500 fine. So stay home and stay out of jail. Thank you and have a nice day.